understanding of genetic regulation of this is extremely important, and there's a lot of information which is now coming up in that regards. So if you talk about genes which cause the hypothalamic pituitary involvement, there are three sequential areas in which they develop. So in the beginning, we have genes which regulate the organogenesis of how this hypothalamus and pituitary comes into the picture. They will also affect the cranial development, the eye development, the ear development, the development of the face, the development of the spine. So they will have multiple effects. Then you have got those who determine the development of the rat case pouch, which will be more local. So they will cause both anterior and posterior, because they will start producing the hypothalamus and the rat case. Then there will be ones which are regulating the terminal differentiation, like the different cell types. And then you of course have the final genes which produce these particular hormones. So this whole process is very tightly regulated, and these genes are switched on and switched off. So they're like an orchestra. So what happens is that you will have one thing going on. So you will have all the initial ones which are part of the initial development, like SOX, LHX, the hedgehog pathway, they will come in. Then you have got the HESX one, which is basically acting balancing. It is allowing the rat case pouch to grow, but doesn't allow to grow it beyond the level. Then you have PROP1, which will switch off the LHX and the HESX, and it will start activating the pathway from there of POW1, F1, the PIT1, and then you have the gene progress. So there is a whole orchestra which is playing, and if you have any derangement, your music, your pituitary development will be gone in that situation. So basically, early embryogenesis, cellular differentiation, mature gland, these are the three major areas in which these genes work. And then you have the development of the different cell types which happens in the mature gland. So the WNT5 and FGF8, so WNT5 we all know, this is an important mesenchymal regulator. We talked about this in ovaries, we talked about this in cartilage, we talked about this in bone. So this is just like a mesenchymal growth. WNT5 is very, very important, as is fibroblast growth factor. So again, these are all fibrosis related factors. Bone morphogenic protein, again, we talked about this in ovaries and bones. So again, it becomes, so these are common to different organs. So these are just developing. So these are like, in a way, you have got these clay and children are playing and they're trying to build the different organs. So these are the tools, primitive tools you can think of. These are like the Stone Age, you can say. Then people are, then humans are making some basic toys. So this is like the initial development which happens. Very important here is the hedgehog pathways, the sonic hedgehog and the Indian hedgehog, which play an important role in the initial development. Now, after your clay has been formed, it has to then be matured or in a way sculpted. So first committed gene, I would say, in terms of pituitary is actually HESX1. All these are common. So if you have defects in them, they will be very severe. If you have a sonic hedgehog defect, it will actually cause holoprosencephaly. And many won't even survive, but they will be very severe. So your eyes will be like in a different direction, your head will be very small. So these will be very severe. But if you start talking about the pituitary phenotypes, it probably starts from HESX1, which is a major initial regulator in terms of growth, and it is involved in growth of both anterior as well as posterior pituitary, as well as the optic nerve and the development of septal pellucidum. So HESX1 defects cause typically septo-optic dysplasia, of optic nerve hypoplasia, of the effect on the septum pellucidum, which is absent, as well as causing abnormalities of both anterior and posterior pituitary. Now, very interesting thing which has happened now is that people have seen that many of these genes are overlapping. So you may have SHH, which may cause the most severe holoprosencephaly, but it may also cause isolated GHD. You may have HESX1, which may just cause optic nerve hypoplasia, or it may just cause isolated GHD, or it may cause septo-optic dysplasia. So there is a whole spectrum. Genes which were earlier considered to not even cause anything except for an isolated defect are now known to cause NPH. So CAL1, which has been traditionally told as okay, it causes only hypogonadotropic hypogonadism, can now also known to cause NPH. So this is an evolving field. So there's an interaction of so many things happening, but we will focus on only the ones which are very clinically relevant. So SHH is one, HESX1 of course is there, and this HESX1 is basically allowing the rat case pouch to mature. So it is what is doing that you have now got some basic structure, and now people are working to make it better. If you load it too much, if your child is just learning the basics and if you load them too much with complicated things, it will cause problems. So HESX1 is that person who is just like, okay, don't put too much pressure on this child, let him mature. And once it matures, you will then allow the further things to happen. So how will you start producing? You say, okay, you produce ACTH, you produce TSH. It is not even ready to do the basic things. You can't expect somebody to do trigonometry when they don't know 2 plus 2. So this is the way it's happening. So you had a very primitive development, the Stone Age, I would say at this point of time. And then this HESX1 is allowing them to grow. This is like a primary school. They're learning a lot of skills which is happening. But if you allow HESX1 to continue, that will be bad because they will not mature ever. So if you allow somebody to continue in the primary school for many years, this situation will cause more confusion. So then you have something to switch it off. So timely switching on and switching off of HESX1 is absolutely important to allow appropriate synchronistic development here. Now, very important genes which come here are the SOX group. Now, whatever we talk about these early genes, except for HESX1, you would have heard everything. SOX is also involved in gonadal development. You've all heard about that, that is part SOX9 and all those things are very, very important. So they are extremely important from that perspective. Now, we know now that SOX2 is a very, very important regulator of what is known as pituitary stem cells. Now, earlier people used to say, okay, your pituitary is gone. You won't have any further development. But now we know that within that intermediate lobe of the rat case pouch, there are some SOX2 positive cells which can actually convert into a pituitary. And there are experiments which have actually been able to develop a in vitro pituitary. So they use these SOX2 cells and give them some differentiating factors and they will develop into pituitary. So these SOX2, not SOX3, but SOX2 are responsible for actually giving a stem cell characteristic in that regard. So anyway, from that perspective, now your pituitary is developing. So this was more like, let's say a KG or a very, very early, this becomes more like a primary school development, which is happening. And HESX1 is giving them time. Like we discussed about AMH, what AMH does is that it allows the follicle to grow. It also inhibits the FSH effect so that there is no premature development. So the same thing is here, that this allows this to grow to a particular level. Having too much is also bad, having too little is also bad. Now from this perspective, you've got some other genes that start coming up, the LHX, which are also responsible for the spinal regulation. And the LHX, some of them persist for life. So they are actually required. Now you need to remember that which of them are there temporarily and which are there for life. They will also have implications in that regard. You also have PITX1, which are playing an important role. Now, once these things have happened, you have started this sealing off of the rat case pouch, and you have the primitive pituitary which has come. You have basically crossed your primary development. Now, here you do not want your HESX1 to be active, because if this HESX1 is active, it will keep on bringing you, it will be pulling you down. So what happens at that point of time? You have got a new gene which comes into the picture. So you can say this is the pre-Prop1 era and this is the post-Prop1 era. So this is very simple. So or you can say HESX1 was a major regulator here, but now you've got this Prop1 which comes up, and the first thing it does, it says, okay, your work is done, HESX1, you go on. And once the HESX1 goes off, the pituitary can now start maturing. It can start thinking of producing more hormones gradually from there. And it also activates the other pathways, the GATA2, and very importantly, the POW1F1, which was earlier known as PIT. So the first, actually, if you look at how these genes were discovered, they were all discovered by experiments in rats. And there they were looking at which genes, which phenotype is there, you delete this gene, what happens, and then you were picking it up. So the first one which was basically identified was HESX1 and PIT1. So PIT was basically associated with growth hormone, prolactin, and TSH development. Then somebody said that there is another gene which regulates PIT1, and then they called it prophet of PIT1, that is PROP. So Prop1 is the major regulator. It switches off your SX1 and it switches on the POW1 F1. So this is like before Prop1 and after Prop1, and this Prop1 expression is also temporal. If you continue to produce Prop1, there could be a problem. If you have too little Prop1, it is bad. If you have too late Prop1, it is bad. If you continue with Prop1 also, that is bad. So you need to have this synchronous attitude which is there to allow, because its role is done. If you have too much activity, it will stimulate too much POW1 F1 and that will cause more problems from there. Now, once these genes are activated, they start regulating the other genes like PITX1, PITX2, and they start regulating growth hormone, prolactin, and TSH beta and produce TSH. So this is the three hormones which are affected in the POW1 F1 mutation. Now, Prop1 is also controlling GATA, which is controlling the gonadotrophins, and it has got some effect somehow on the ACTH axis. The exact reason for that is not known, and that is why not everybody with a Prop1 mutation will have a problem with the ACTH. ACTH is very, very important for the body. If you talk about all these hormones in the pituitary, if you talk about TSH, if you talk about LH, FSH, prolactin, GH, and ACTH, the least important is prolactin. Then maybe gonadotrophins, because they don't do anything, LH and FSH. GH then will come in because GH gives you some glucose, some lipolysis. Then TSH, of course, because of temperature. What the newborn wants is temperature and glucose. This is what you want, and that's why the hormones are there. The most important is ACTH. So ACTH is being given an alternate way to develop as well. So this is not directly regulated by Prop1. It is actually regulated via a TPIT pathway, and it is usually very resistant. The only condition in which ACTH is more affected than other anterior pituitary hormone deficiency is autoimmune hypophysitis, in which you have a TPIT antibody. So that's a default. That's not the body wanted to do. But all other causes, radiation, trauma, whether you talk about genetic causes, your ACTH is protected. So if you have an ACTH deficiency, invariably you will have other pituitary hormone deficiency. That's a big message which will happen. And TPIT is the one which regulates basically via NeuroD1 the POMC, and POMC we know is the pro-pumilnocotin, which regulates the overall growth of MSH, endorphin, and ACTH. And here you develop the ACTH producing cells which are there. So in a way, this Prop1 is regulating all of what we talked about, but the effect is minimal on ACTH. So Prop1 may behave like PIT1 to begin with, but they will cause subsequent development of gonadotrophin deficiency and variable ACTH deficiency. So they may be short stature, you're given growth hormone, you're given thyroid, you're given sex steroids. Now they come to you with sudden weakness. And this could be, looks like an acquired cause of NPHD, but it's actually Prop1 in that regard. Now, Prop1, as discussed, is an important regulator of pituitary growth overall as well. So the pituitary size, particularly the intermediate lobe, may be small, normal, or enlarged also in Prop1 defects, depending upon when the defect happened, what happened in those regards. So if you have somebody who has a long-standing GHD, TSH deficiency, gonadotrophin deficiency, now develops the features which are suggestive of ACTH deficiency, you do an MRI and you find an enlarged pituitary. Before you rush to a cellular mass or a supracellular mass, think of a Prop1 defect, which may be a transient cause of these abnormalities which are there in that regard. Now, GATA2 is the other one which is regulated via the Prop, and this then regulates the FOXL2 pathway, the alpha subunit, and alpha subunit is common for TSH, LH, FSH, and HCG. And this will then, along with that, result in production of the LH and FSH. So this is how the entire process happens. So if I now summarize it again, what we have is that these are primitive areas of development. These are like Stone Age development. You've got basic tools like WNT, FGF, Hedgehog, and BMP, which are there everywhere. So like you're building bone, you're building cartilage, you're building pituitary as well. So defects here will cause massive problems across the body. Then you have got the first agent, which is really bringing it up from the Stone Age to maybe to the Iron Age or whatever in terms of historical perspective, or to a primary school level, is SX1, which is allowing them to grow. SX1 is switched off by a Prop1, which allows a mature development of these cell types. So if you have too little Prop1, they will not develop. If you have too early Prop1, you can also have a problem happening in that regard. SX1 is supported by SOX, LHX, and PITX. Abnormality in these 4 genes will cause both anterior and posterior pituitary dysfunction along with craniofacial abnormalities. So you will have eye, ear, spine. They will have a problem. So if you have all of these, think of these defects. Problems from Prop1 will only affect the anterior pituitary. They will not have any craniofacial abnormality. They will not have any pituitary abnormality on MRI. Now, all of these will have a lot of pituitary abnormalities like hypoplastic anterior pituitary, absent posterior pituitary, hypoplastic stalk, and all those things. But this things from Prop1 onwards will not have any of these problems, and this is something which you need to really understand from a clinical perspective. From there, you have got the POW1F1, which regulates the 3 important GH, PRL, and TSH, GATA2, SF1, DAX1, which regulates gonadotrophin, and you've got TPIT, which is regulating the adrenal. So this whole genetic axis is quite complex to understand. If you have got facial abnormalities with anterior and posterior, think of SX1, SHH, think of PITX1 and LHX3. If you have got GH, prolactin, TSH along with ACTH and gonadotrophin, think of Prop1. If you have got GH, prolactin, TSH, think of a POW1F1. If you have got a predominant adrenal involvement along with abnormality in gonadotrophin, think of DAX1 or SF1. Just our central adrenal involvement is TPIT. So this is what the whole genetic part is. This is very complicated. We'll discuss again and again to get a fine tune in that regard.